Hello, this is Dr. Shariu Bhagat from Oasis Fertility, Vakat, Pune. So today my topic of discussion is how does sexual dysfunction cause male infertility? So sexual dysfunction is often overlooked, but it significantly impacts many individuals and couples who are striving for pregnancy. Male infertility is a multifaceted issue with various underlying causes, and sexual dysfunction is one of the critical factors that directly as well as indirectly hinder man's ability to conceive. So, what is sexual dysfunction? It refers to any problem that prevents an individual or couple from experiencing satisfaction during sexual activity. There can be different types of sexual dysfunctions like erectile dysfunction, premature ejaculation, delayed ejaculation, and low libido. So I'll be discussing each of the sexual dysfunction. So come first is erectile dysfunction. It is inability to achieve or maintain erection sufficient for satisfactory sexual performance. So, how does it impact the fertility? It affects the sexual intercourse, which challenges the deposition of sperm into the female reproductive tract, and thus it prevents the conception, which also can be linked with cardiovascular diseases, diabetes mellitus, hormonal imbalance, which further impairs the sperm function. Premature ejaculation is when the ejaculation happens sooner than desired, which is often before or shortly after the penetration. So it prevents the sperm deposition near the female genital tract and near the cervix. Thus, it reduces the chances of sperm reaching the eggs. Many a times, the ejaculation occurs outside the vagina. This and performance anxiety is also associated with premature ejaculation, and thus it creates stress and it reduces fertility. Coming to delayed ejaculation or ejaculation. When ejaculation takes an extended time during sexual activity, and an ejaculation is absence of ejaculation. So the impact of this is reduced likelihood of successful intercourse, which causes infertility. Coming to low libido or sexual desire, low sexual desire, it is a decreased interest in sexual activity. The impact of this low libido is it leads to infrequent or no sexual intercourse, which affects the conception rate. So, and it also relationship issues or any history of medications. So, without any regular intercourse during fertile period, it causes infertility. Underlying cause of sexual dysfunction related to infertility, it can be hormonal imbalances, which is abnormal FSH values, decrease of testosterone. This all leads to ejaculation disorders, decreased libido, impaired sperm production. Psychological factors like stress, anxiety, depression, relationship issues, it affects the sexual function and infertility. Also, there are some chronic conditions like diabetes, hypertension, obesity, neurological disorders, which contribute to sexual dysfunction, and it also compromises the sperm quality. The psychological impact due to sexual dysfunction is a vicious cycle. So, first, there is performance anxiety, which leads to sexual dysfunction, which increases stress, and thus it leads to impaired sexual function. Ultimately, it leads to low fertility rate. So, the coming to the management of sexual dysfunction, medically, we can manage ejaculation disorder by giving hormonal therapy. If hormonal therapy doesn't work, we can go to surgical solution and address to the physical cause of dysfunction. Psychological support should be given. Counseling therapy, stress reduction techniques, which reduces anxiety, depression, relationship strains, which ultimately leads to infertility. Lifestyle modification should be done, like improving the diet, exercise, quitting smoking and drinking, managing chronic condition. This overall increases sexual health and fertility. I would like to conclude by saying that sexual dysfunction, it plays a significant role in male infertility, and it affects the ability to conceive both directly and indirectly. So recognizing and addressing these issues is essential in journey towards a successful conception. So if you have any doubts related male sexual or any female sexual problems, or any problems related to infertility, you can visit to Oasis Fertility or contact to the phone number given below. Thank you. If I'm sexual. So if you have sexual dysfunction, first you need to visit a counselor. You can visit a andrologist, and you they can counsel you psychological and test. You need to be the test need to be done a hormonal test like FSH, LH, testosterone, and prolactin. So it has seen in the studies like smoking, it decreases the sperm motility and concentration. Alcohol use in more than the required dose, it also leads to stress, and it leads to leads to oxidants which impairs the sperm function. Obesity also, it reduces the sperm number. So overall, all this consumption leads to sexual dysfunction, and it ultimately leads to infertility in a couple.